Thank you all for taking time out of your Tuesday night. As Jordan and Aaron said, please ask questions. I'm going to answer as many as I can. Obviously, more on the clinical dental side, owner side. I always try to answer the neo lab or lab questions, but having Christian here is a good opportunity for you guys if you have more insight needs on the workflow. I'll get us going. So just a little bit about me. This is my family. I'm born and raised right outside of Tampa, Florida. Did dental school down at Nova, and then did my pediatric residency at UF Naples. Currently own my own practice in Apollo Beach, which is just a little south of Tampa, and I run a tongue tie center out of there as well. I will get moving into this a little bit. So main goals for tonight. First, we're just going to understand benefits of using a digital scanner versus traditional impression. There are a lot of benefits in my opinion. That's why I'm here to talk to you guys about it. And then we're going to kind of translate that into exploring how we use it clinically. Using it at its base level, you're still going to gain a bunch of benefits in your practice from it. And then there's also other opportunities that you can use with a good scanner that make your life easier and your team's life easier. We're going to learn some scanning techniques. Luckily, with the scanners, they're super simple to use. We also are going to have a little video session of how to set it up, how to use it, how to get your first scan. We're going to learn how that all integrates with your labs and how to actually like make your life easy in the office where you're spending less chair time in mouse fighting for impressions and more time doing productive procedures and helping the patients that need it. And then as business owners, if you're looking into buying one, we're going to talk about the financials of it. We're going to look at the ROI, how much things cost, how that can save you money over time in your practice, the immediate tangibles and the long-term, maybe less tangibles that you can integrate. So we'll get going, and like Jordan said, enter any questions into the question bar down at the bottom, and we will have a full kind of walkthrough at the end. So why am I here? I've been asked by the team to talk to you guys because I've been a scanner owner since June of 2023. I jumped in kind of when I was introduced to it. I've always really disliked physical impressions. One, taking them on squirmy kids who don't like goop in their mouth, and then having to retake them, and then sometimes having lab issues with pulls or tears or bad pores, and having to kind of redo those things. In my office, I try to be very efficient, try to be respectful of my patients' and parents' time, and this has helped us really just make appointments concise, make them quick, make them easy for everybody. And the digital impression itself just makes for such an easier seat of your appliances, which makes delivery even easier. We've integrated into our day-to-day workflow. We use it all the time. We use it from a lot of traditional appliances that everybody as pediatric specialists are going to use. And we use it for some other things that we're starting to delve into a little bit. I love it because it's easy for my team to use and it makes my life easy. I don't have to like stress on any of those appointments. Other aspect of my office, I'm always wanting to be kind of pushing the limit of technology. We live in a very fast tech world. I want to make sure I'm using anything I can to benefit my practice and make it easier for my patients, get good clinical outcomes, and also market for my practice. Like people want to go to an up-to-date dentist. So those are things that I've always strived after, and that's really what kind of took me down the avenue of using it. So the main thing for me, as I mentioned, I just didn't like impression visits. Some kids are super chill. Quad trays are easy. If you're doing full arch impressions on kids and you need a lot of detailed anatomy, those could be hard for some kids, especially with smaller mouths, gag reflexes, or just a disdain for the dentist itself. I don't spend time taking the impressions. I don't spend a ton of time reviewing my prescription slips because the workflow is so straightforward that once your team learns to use it, it makes it just a very simple process. My dental assistants learn to use it very easily. We'll talk a little bit about training your team as you're going through it, but it's really like a plug and go and play with it, and you're going to get it very easily. I don't have to worry about any alginate messes, any lab stuff hanging out. I don't have to worry about pouring stone. I don't have to worry about disinfecting impressions. And I don't have any inventory of that aspect in my office. I have like one little box with some alginate, some PVS, and some trays just in case I need a physical direct impression. But at the end of the day, I haven't used it since. So for me, it's kind of just collecting dust, and we've been able to clean out a lot of closet space, which in any office is treated like gold because you don't have a lot of it. At the end, it just makes your parents happy, makes your patients happy. And for me, it makes me a happy doctor, which translates to a happy team. So it's all a win. Efficiency's there. So the accuracy of the scan makes it perfect fit every time. You don't have to struggle getting the impression. When I was in dental school, we did learn to use some intraoral scanners, and that was always my biggest issue is like I lose my spot, I couldn't get it fast, and I'm disoriented. With this, it's a very simple kind of redirect and get your anatomy back. Makes for just a quick, nice impression, and then your lab's going to have a perfect impression of the mouth. There's no did a lab make a mistake on the pour? Did they kind of print this wrong? Was that my job of doing it, or was that theirs? You can always point fingers when you're talking lab stuff. With this, it makes it much more smooth. With faster chair time, you're going to have more appointments per day. So we were able to shorten all of our impression appointments, shorten all our delivery appointments because the appliances fit smoothly, which means I can put more productive procedures in, help same day emergencies, and just be more efficient in the office. The integration with everything that I use in my office, very easy. I use Open Dental because I love to have easy third-party integration, and this was smooth. It works with any lab that takes an STL file. We'll talk a lot about NeoLab and how their flow works, but in all reality, you can utilize most dental labs for appliances, aligners, and a lot of other things if you want to really get into it. The big thing that I love the most is the indirect banding. I used to place all of my own bands. It's how I was taught in residency. I wanted it to conform around the tooth really well, and make sure everything sat as perfectly as I could when I shipped it off to the laboratory. Now I don't have to do that because I know my model will be 3D printed off of my scan, and then my appliance will be 3D printed on top of that model. So it's all computer driven, and it makes it just a smoother process. So main reason I went with the Allied Star, I have the AS200E, which is the cordless one. We'll kind of talk through the cordless and corded option. It came with a laptop, came with a good warranty. It was simple to use. It was very cost effective when I was comparing everything out on the market, and it was made in pediatrics or having pediatrics in mind. For me, that was big. I don't like a lot of cords. I like a very clean office. I try to keep hoses and things kind of tucked out of the way. I trip on things. I let a lot of kids in the office. I let families come back and hang out. And I got a lot of 2-year-olds running around while I'm doing things on their kids. For me, it's like kind of a family feel. But at the end of the day, those kids can fall, and then I have another emergency on top of the patient I'm treating. I like the cordless aspect of it, and it's still very light in your hand, still very easy to use. The small tip was perfect on those really little mouths. I can still get scans as necessary. And then it has a larger attachment for my teen patients if I have a big mouth, and I can kind of get a better field of view. No recurring cost was huge for me. I do not like getting nickeled and dimed by companies who want me to spend X amount of dollars every month or an annual recurring fee for a warranty or whatnot. For me, that was a huge aspect of it, and we'll have a little comparison chart. And then I already kind of spoke on the open architecture, integrating with other places, and the partnership with NeoLab is nice. I used to use a different lab, and when I was talking with New Smile about this scanner at an AAPD conference before I bought it, NeoLab was there. I was able to have a conversation with probably you, Christian, actually, and working through like the benefits of that. It made it more of a no-brainer. And when I looked at the cost benefit ratio, it weighed in the favor of utilizing not only the Allied Star but also NeoLab for my office. So this is kind of what I did my research on. I wish I had this when I was kind of looking at it, because I just talked to the guys and kind of put everything else I had already researched, because I was looking at a few of these other scanners. The cost is a big thing. We're practice owners. We have to kind of think about, if I'm investing this, am I going to recoup my money? Is it going to make my practice money? A lot of people buy things for their office and they sit in the corner. I didn't want something to get purchased that my team wasn't going to use and that wouldn't benefit me in making my office more money. This is something we can come back to, but you can see the difference between the AS260 and the AS200E. The 200E is the wireless one. The 260 is the corded one. Literally, the only difference is a cord and a little USB that you plug into your computer, which you'll see with Jordan. I love that there was 2 tip sizes. Having it made for peds is huge, because we work in tiny spaces. It's very different than adult dentistry. But this is just a nice little layout so you can get that snapshot of what you're getting, what are the pros, what are the cons. Now, this is just kind of like for your day to day, like what's your workflow when you're taking your impression, sending it out to the lab, and getting it back from the lab. The biggest thing was the scan, like scan versus impression, fighting a kid, gagging, maybe throwing up in your chair versus just playing with a little camera. Kids think it's super cool. They like video games. They can see their teeth on the screen. That's a very easy way to use behavior management, is like letting them play with it first and letting them scan something. They get excited for it. You scan a couple teeth, show them on the screen, and then it's a very easy workflow. You don't have to pour anything up, so you don't have assistants taking extra time there. They can spend other time in the office doing more productive things. You're not trimming anything. You don't have stone everywhere. You don't have clogged sinks, which makes it easy. And then also, I like that I'm only shipping one way. I'm not going back and forth, and you can make sure that they kind of compile your cases. So if you're like, hey, I don't need these cases till X day, I'm going to kind of get my scans done over a few days and then kind of put them all in at once, and you can kind of get everything shipped back at once to save some cash. Really, just from the basic workflow side of things, you're going to save money right off the bat. The first year that you use it, you're going to make some money back. So that's where your ROI just starts, from the basic day-to-day, doing your band loops, your space maintainers, your habit appliances, mouth guards, like your normal stuff that you as a pediatric specialist are going to do. So this is kind of what we'll show you guys. So you can just get like the step-by-step, like how to get the scanner and the laptop set up. I like that the scanner comes with the laptop. Everything's preloaded. You don't have to like go talk to your IT guy. Did I get the right processor? Is it this is the right laptop? And that was a piece of my like pricing those other scanners together. Did it come with it? Did it not? And then talking with my IT guy, he wanted to get the specs, so he made sure we weren't purchasing things twice. Really starting the scan, troubleshooting it, and then adjusting. These are little things that you get very easily. My best thing I did for my assistants was like play on it, do it to each other. Like first day we got it over lunch, we opened it up, started playing with it. All the assistants got it quickly. Your young assistants are going to get it quicker. They're used to technology. If you have some very veteran assistants, even my more veteran assistants who are much elder than I, they got it and they know how to use it, and they like using it now because it makes their life easier. They're not fighting kids for those impressions. And then, obviously, like anything in dentistry, adjusting yourself and the patient and your positions make it simple. And then I already talked a little bit about that reorientation, and I'm going to start the video so you guys can see some of that in detail. And this is Jordan. And they'll get going for you guys.
So today we're going to be going over how to set up your scanner and going through a full scan. So first thing you want to do is take it out of the box here. We're doing the wired scanner to this AS260. You want to be sure to grab your power cord. We're going to get this all plugged in. So you can take a USB, plug it into your laptop here. Now, we'll get our scanner set up. Now, you're going to want to take off your protective cap, and you want to use one of your scanner tips. This one is Aaron's. So go ahead and pop this on. We'll take your little holder. I'll set it aside for right now. Now, what you want to do is you're going to want to open up your software. We're going to use AS Connect right here. So we're going to open that up. Now we get that open. Then to go into our cases in here, we're going to want to select new case. So we'll be practicing on Aaron. And as soon as you make your case name, it's going to auto-populate generate. So up here on the top right, we don't need to worry about anything else at the moment. We're going to hit scan at the top right. Once we hit that, this is going to open up what's called Scan Pro. This is our scanning software. We take our scanner off the charging base here. We can see light is always on. That does not mean it's scanning. However, when I press this button at the top, it begins to scan. Press it again to stop it. No box enters. So today we're going to be scanning Aaron. We're going to start with the lower. So all we got to do here, click the little M button. We can see the top of the laptop. Right up there on our lower icon. However, if you don't scan the proper upper or lower, you can always flip it in the software as well. So you don't have to worry too much about that. So we're gonna go ahead and scan. So what you want to do is we want to start in the posterior on the occlusal surface. So we're going to start back here. Go back to the occlusal surface. We're going to work our way all the way around. Once we get the full posterior, we're going to start to work our way buccally. And then we're going to go where we just stop our scan. And we're going to see what information we have here. So now at this point, these specks here, these green specks are telling me where we need to go back and hit. So we can see we have some interproximal spaces, mainly on the lingual side, and then here on the facial of the anterior, of the lower incisor. So all we're going to do, we're just going to go back in, we see our spots, and we're going to touch this. Why don't you open up for me, Aaron? So again, I remembered mainly on the lingual surface of the posterior. Make sure we hit all the different proximal spaces. And then we're going to come up here to the anterior. We're going to make sure we're going to try and get above that facial side. So that should be pretty good. And what we can see here, we've filled in just about all the gaps there. We have a couple little smaller interproximal spaces, but we're perfectly good. So now we can see our 3D rendering here, really good scan. We don't need to cut anything out. Of course, if we were going to be doing sort of space maintain or anything else, we don't want to go touch up on those spaces again, just for the greens. But right now, just for records, we're good to go. So only difference would be, we're just going to do the lower today. If you wanted to, you would just click over into the upper, do the exact same thing on the upper, and then full bite, once you have the upper and the lower, scan both sides for your full bite. However, we're just going to do the lower today. And again, the main point is you want to start in the occlusal surface in the posterior, work your way all the way around, work buccally, lingually, and then that should be your whole scan. So now we're going to click up here when we're done with our scan on the refine tab. It's telling us we have not captured the upper, it's fine. So once we hit refine, what this is doing is this is turning the scan from a raw format down to an STL format. So it's really, really condensing that scan. It's kind of talking to itself. And now we can see, boom, it's refined. And now at this point, we're finished. What we can go ahead and do is we can click finish up here at the top right. And then now we have our file. We are finished. We now have Aaron's lower jaw scanned in here, and we can do with it as we please. And that is your whole start to finish, setting up a scanner, getting a scan, finishing your case as quickly as that.
Nice job, guys. So that really is how easy it is. I did the same thing. I unplugged or just opened the box, started plugging things in, and started playing with it. That's all you really need to do for your training. One of my tips, like you said, that start on the occlusal and just kind of capture as much of the anatomy as you can. We'll usually set it up so like the assistant's looking at it. So it's like, oh, I missed a green, and you can go back. It's really simple once you do it a few times. Having your assistants do it to each other first is great. They get to kind of get comfortable with it, understand the angles. But that's my best advice when you're getting integrated into the office for the first time. Give some sessions, pay your team over lunch, get some pizza, let them just play around with the scanner. You're gonna build a little bit of fun into that day. You're gonna feed them a little bit. They're gonna like you for that, and they're gonna get some good training at the same time. This is an actual patient in my office. This is one of my assistants. She's going to show the full kind of upper and lower and bite registration process on one of our patients. This guy loved the fact that his teeth were up there. As you can see, we have this little cart we put it on with some of our other equipment, and she can kind of visualize, hey, okay, this is going to be for a Nance. I need a palate. If this is just going to be for a band and loop, I just need a quad, lower lingual. You don't have to capture every bit of anatomy like you're doing, a denture case where you need every vestibule and everything kind of put together. If you know what you need for the lab and you get that anatomy, you're going to get what you need from an appliance back from the lab. Patients love it, especially like this age group, because they think it's cool. They play with video games all day, and then their mouth is the video game. That's just getting both of them together, and now she's having them just bite so she can capture the posterior bite. You do right, left. Computer system kind of puts things together, and obviously that was sped up a little bit, but that's how fast the scan goes in the office, and then you're done. She puts the lab script together, and at the end of the day I review them, send them off to Neolab, and we get our appliances back perfect every time. And then this is somebody else who donated a video. This is them training their team. So they're kind of doing that, hey, let's play with it. You can see here that green box. That means you're still on a spot that you captured before and you're capturing new anatomy.
If it stops, you have to go back to an already scanned area to pick it back up.
Okay, got it.
And that's what I like about it. You just kind of wave it back to where you were. You'll start hearing the clicks again, and you can just keep flowing through everything. This is kind of what we did in our office when we first got it. And then as new team members come in, if we hire somebody, we're going to be like, hey, let's have a little training session and let's have one of our more veteran assistants walk you through it. And now we can utilize some of these other videos that like Jordan and Aaron just put together for our team trainings too. Now, as I mentioned, like once you're done getting that scan, if you use Neolab or another laboratory, you're probably going to have some software that you can open up and integrate that file into. This is kind of the create a case kind of section. I'm going to walk you through a video on what my team would do after they got that impression. My team knows the landmarks. They're always going to double check if they're unsure, if it's like a weird operculum over a tooth or a very malaligned position of something that we need. They're going to come to me. But if it's just a traditional appliance and all I need is the sixes and the back of the lingual anteriors, they know what they're getting, and then they can jump right in and start going through the lab. It has all these little templates you can put together. This makes it very simple for your team, so there's less ability to kind of screw things up. You just kind of plug and chug your patient information. I really like, as you're going down, a lot of the really self-explanatory kind of drop downs. And then as they're going down further, they'll kind of hover over these little image kind of folder looking things, and it'll pull up what that view is or what that is when you're looking at it. So if you're doing it or you're training your team, can go, that's what that is, and they can recognize it really quickly. Like there, you can see, okay, this is what my band or kind of attachment's going to be, and then you can make sure you're picking the right one for the right case and getting it done correctly the first time, as opposed to like guessing what your team's writing down or you guessing what the lab wants. Those little pictures help a lot. Already we're done with the lab script. It's ready to be sent off to the lab. So, within that minute, that whole lab script's done. That assistant can now kind of put this to the side and go get a new patient or clean that room or sterile, do what they need to do to help the office, flow through the day and be really productive. These are just little examples of different prescriptions that are integrated into the Neolab format. Normal habit breaker, if that's something you're going to use, you pick your teeth you're going to place it on, what kind of band attachments you want. And again, it's plug and chug, makes your assistant's life a lot easier. We do a lot of the 3D lingual arch prescriptions, obviously, as a pediatric specialist. We'll make sure we put all this info in so the lab knows what's coming out and how we want the actual appliance secured to the tooth. I don't use a lot of traditional bands anymore with the 3D SLS printed options. It has a very nice ability to kind of sit just on the cuspal aspect of the molars, and the intaglio of that is very kind of etched, so you get really good retention from your cement. I was very hesitant to think that was going to work well when I first started cementing these, and using a light cured resin modified glass ionomer cement, it sticks, and getting those off are way harder than any other full banded kind of bent in band that I used to use in the past. So D-bonds are a lot less in my office since we've switched over to the 3D printed option, just because it fits the anatomy so well. And then the same thing with your Nance. If you've got a special patient that wants to pick that special acrylic color, let them do it. That's an option that they give right there on the home screen. I like this. We have these printed and put different places, especially for newer assistants, people who are training right out of school or even doing an externship. This is just great for them to learn, hey, if I'm making this appliance, this is what I need to capture. And Neolab throws this together for your team. Obviously, these are the kind of most common pediatric appliances that you're going to use in your office. Really, you can fabricate anything. I had somebody email me after a lecture one time or a webinar one time, and they were like, well, can you make this? And can you make this? And I'm like, if you can make something on an impression, they can probably make it. Talk to your lab. They're going to be able to fabricate things for you. Correct me if I'm wrong, Christian. But a lot of times if you get the anatomy you need, you can explain it, draw it, just like when you're in dental school, you draw all your wires and where you wanted things laid out. It's the same kind of process, just much easier workflow in the digital world. These are those band options that I was kind of alluding to. The old school doctor fit, that's what I did. Hey, I was always going to fit my bands, take those bands off, put them in my alginate impression, send it out. I used algin 8, so I didn't have to pour, and I would just kind of send it out. Or you can do old school indirect. Like, you don't have to fit your own bands. You can just send the actual impression, digital impression, to the laboratory, and they will make some little proximal slices and make sure that that fits well. I love the 3D SLS. It is much nicer to the gum tissue, so your gingiva is not impinged. On those kids with puffy gums, and most of our kids who are needing spacers are, lackluster in the hygiene department, or on those developing kids where those distal operculums are still real puffy, real fat, and they're kind of laying over that distal surface. You can have them modify how this band sits. If you want it this way, but with like all the cusps covered, because you don't want that occlusal exposed, you can do that. If you wanted a 3/4, you can do that. I've made custom kind of things for different patients, giving their anatomy and the situation we're in during growth and development, and that's become my favorite. Say like 95% of my traditional appliances I do with the 3D SLS now, just because it's such a clean fit, and the bond with that kind of light cured resin modified glass ionomer cement works wonders. So this just gives you kind of the example what you were doing, if you're replacing seps, allowing your band to kind of seat all the way, how you're kind of curing your cement, whether it's self-cure or light cure. With the 3D, there's no band or sep placement because you're just bonding to that occlusal cuspal surface. You debond it just like you would any other spacer. So it just saves you a step, saves you some time, and patients like it. Like even my very, very TLC patients, I can get these typically delivered. If I can get a kid to open and let me touch their tooth with my finger, we're going to get that thing cemented because it's very minimally invasive. It's not an uncomfortable thing for a kid with gingivitis or a kid that doesn't like sensory in the mouth. You're really just touching the enamel, which is nice. This is some stuff from my office. I have done traditional band and loops with it when the time comes. I do use the new Smile chairside kit a lot now, so I haven't done as many of these. What I liked about this compared to like me taking a quad arch and kind of sending it out for my traditional lab stuff is I don't have to adjust it. I used to always have to like do a little bend here, maybe modify how it rests against the canine and use a 3-prong to kind of bend it in a little bit. The 3D makes it so custom for it that your model's exactly what you scanned. There's no like of those discrepancies. Was it poured wrong? Was it soldered weird? And you don't have to really stress on it. So you can do your bread and butter if it's not something you make yourself in your lab or in your office chairside. This is how those SLS 3D printed ones kind of sit on the teeth in the back. That middle one, you can kind of see the intaglio. It looks a little frosted. That's a lot of like that micro etching that allows for that good surface area for bonding of your cement. And it just sits very passive on top of the teeth, which I love. I do sometimes have them modify the distal aspect on those 6s, especially on the younger kids where they got that operculum sitting and there's still a pretty big pocket, just so I know I'm not impinging on that. And cementation on those TLC kids are a lot nicer. And I do have some clinical cases that I'll kind of show you some examples of. It also lets you think outside the box as pediatric dentists. That's something you're always doing. This was one of my thinking outside the box cases. So this girl was one of my, very terrified. I don't know what she was, like 8 at the time, something like that, maybe 7. Obviously, lower right molar, we had an irreversible pulpitis. She was not going to sit in the chair for the work. We knew we needed a sedation. I knew I didn't have the time due to having a sedation in like 2 days to get her done and out of pain to make a scan, of everything, send it out, do it kind of traditionally. So I was like, hey, we're going to get that tooth out. We're going to scan for this. She didn't have 23 through 26 in yet. So I was like, I'm not going to make a full lower lingual. And the distal operculum of 30 was very inflamed and very sensitive. So I knew she wasn't going to let me seat a band there for like a chair side band and loop. So I was like, hey, I'm going to try this and see if it works. I told mom, I do not think this is going to stay. I think it's going to debond. I think we'll have an issue with it. But this was probably back in like 23. Like it's been a couple years, and that thing is still hitting strong. I haven't had to modify it. I'm not going to modify it. She is a very tough patient, and I always told mom, like, when and if it goes, we'll modify. But that cement has held even with the kind of awkward presentation of the operculum and it just sitting on the more mesial 2/3 of number 30, which was pretty cool. That made me a believer in that kind of intaglio and the bonding, knowing it was just a unilateral and not fully under the gums there. This is another one. Kid, special needs. We had to get Jay out. We needed an Nance just to keep everything where we needed it. So the goal was to get it out. He was very big on me not touching his gums. He would let me touch his surface of his teeth. I could take an Explorer and touch everything. But as soon as like I even took a normal soft bristle toothbrush to the gums, he was jumpy. And it was just more of a sensory aspect. So this allowed me to get it fabricated and cement. Kid did not even care. So mom was very happy to kind of prevent like early ortho kind of needs in this sense, and just to get the work done quickly. I do a lot of those now. This is a kid that came to my office and never met him. He was a new patient, limited exam, emergency visit, pain, a little bit of swelling, needed the tooth out. My goal was to try to get him in and out of the office quickly. He was a very nervous kid. We used the SOAN to kind of get him numb, did our impression, and this is after local. Let's see if this buffers a little bit. After local with SOAN, that takes 2-3 minutes. We do our scan. Wanted to get everything kind of in and out as fast as I could because I was kind of squeezing them in. He's very receptive to tell, show, do, and kind of walking him through things. He was a good kid. But at the end of the day, we got them in, scanned, tooth out, and then delivered the appliance in, the 2 to 3 weeks it took for the turnaround within 30 minutes. That's a huge win for the office and same day production. It's a huge win for the parent. They don't have to come back for those visits. And the kid, it built a ton of confidence in him that like it was going to be painless. It was going to be easy. And the cementation was super smooth. And at the end of the day, like this is a great patient now and the whole family comes to us. So these are the things that make your life easier as a practice owner. If you got a little heme in there, it's not a big deal. Like that can be kind of cleaned up. Obviously try to make it clean, but when you're doing dentistry, you never know what you're going to get when you're in there. And that was me scanning, and I'm not as fast as my team because I don't do it as much, but it's still super quick. So again, this is just another case where we're going to be extracting some second molars. The E's are coming out. We need to make sure we're maintaining the space. Another kid that was not happy with me in there in the mouth doing anything after they were awake. We did all the work needed under sedation, and then we were able to kind of cement nice and easily without them being concerned with any feelings of it coming through. Now, this is another aspect of the software that comes with it. I'm going to see if I can do this real quick. I'm going to do a little stop share. I'm going to pop this up. I'm going to bring this up. And then I'm going to bring you guys back. So this is some software that they have that you can utilize to give like patient education. It's AI driven. Simple to use. If it's something you're doing bigger treatment plan presentations for, if you're doing some older kid dentistry, you're including any orthodontics, and you want to kind of comprehensively walk a parent through a problem list, what they have going on, what you guys can do to remedy the problem, and kind of give them a better understanding and actually have something to like kind of print out or email to them and take home. What they're doing right now is compiling intraoral photos and then obviously your scans into the system. So you're kind of like prompting it a little bit, and then you just hit the AI assist program or button there, and it's going to start putting everything together for you. So instead of you having to like sit through and copy and paste pics and copy and paste files and put videos in different spots, for people who are doing more comprehensive full mouth dentistry, this it makes it a very like cut and dry. This is what we're doing. Obviously, you can go back in and modify as you're doing things if the AI didn't pick it up perfectly. But it's just one of those little added benefits that you guys can utilize in your office. We do this sometimes for patient education if we're playing with things. Most of the time, I will use just a scan of the mouth and use it as a model for the parent so they can see in their face kind of what I'm looking at in the posterior. And when you do that, whether you use intraoral photos or your scanner to kind of show parents that, it makes it very easy to explain. Parents are more on board with getting treatment needs done. They can see how big that hole is or how nasty that gum looks. And for me, it's all about patient and parent education. I want them to be on board with what we're doing, know why we're doing it, and it makes case acceptance a lot more smooth, and it helps you be a better dentist in the long run. And that's what using technology is beneficial for. With everything coming out nowadays, I try to make sure it is looked at before I just throw it into my office, make sure it's going to be successful. Here you can see kind of an ortho simulation of what you can get to with aligners and kind of what your goals are. But obviously this patient had a lot of caries control to kind of get through first. Something you guys can add, something you can use, something you can just play with. But at the end of the day, something that's there. So now I'm going to pause this and I'm going to get you back to our presentation. All right. So that's all like the bells and whistles of how you use it, how to set it up, how to kind of troubleshoot, get your team going, different ways you can use it in the office. The nitty gritty of it as a business owner is ROI. Like, is it going to save me money and make me money? The simple, tangible things that we talked about, you're not going to have trays. You're not going to have material costs because you're not buying those monthly anymore. You're not having to keep them in the office and take up space in your cabinets. Remakes are really non-existent. I might have one remake that I had to do over the time I've had this. And it was a case where the kid did not come back for like 3 months. And obviously space loss had occurred more than I could bend that wire back. So we just rescanned and had it back in 2-3 weeks and cemented a new one. But if you're doing your normal workflow, you're not going to have remakes because the digital impression is ideal. And then if you're 3D printing your appliances, that's going to be ideal. And the fit is like a glove. It's like getting that perfect crown back in dental school where you didn't have to adjust any contacts. It makes your life a lot easier and your patients a lot happier. You're going to save on lab fees because you're only shipping one way and you can kind of put it all together there. Chair time, I think, is the most beneficial. Like, you are going to be more productive while you're saving chair time. You can be in another room, doing a consult, doing some same day treatment, helping a patient, or just getting through some recalls faster and making your turnover a little more efficient so your team can kind of flow through the day a little easier. Quick appointments make it smoother to kind of tighten your schedule down. We always block a ton of time in my office. I make sure I can spend a lot of time and talk to patients, but this really helped it. So I can do my combo, my chit chat, talk about a football game, and the parent's gone. Like, it's super quick. My whole goal is, don't work harder, work smarter. And this helped us do that. Your 3D model inventory is now digital. That is one of the biggest things I didn't think about automatically. And Jordan kind of pointed out to me, he's like, you have old ortho models in your office? I'm like, absolutely. They're like all up in my cabinets. You can just have one of your team members scan those and put the patient's name in, and it's in the cloud. And now you have all of those legally that you have to keep for so many years without having to keep a bunch of white models that you got back from the lab in your office. That is nice just to clean up space and do a little spring cleaning. And then just the impression and delivery, super quick. So that's like what you're going to get, like, kind of right off the bat.
Casey, I'm gonna have to call you out. That's the first time I think I've heard you sound a little bit old. You said, not the cloud. It's just a mythical thing, the cloud.
It's up there. I'm almost 40. I'm getting there, man. I'm getting there. Now, long-term ROI stuff this has helped me like just build confidence. Like, oh, I can make that. It's not something that I have to like really think about too much. I can have a conversation with the lab or look at what's on their website and go, I can make that appliance. I can make that for you guys. This is a procedure that I can kind of add to my office. The ortho liner aspect, we've been doing like limited ortho liners if they're super bread and butter, class 1 malocclusions, and I like the parent, I like the kid. We're going to do those for them. Like I can keep that in house, kind of be more productive. I used to hate when I was about to do aligners on kids because I did Invisalign for a little bit when we were first opening, but you needed that like perfect PVS impression, and I didn't have a scanner. And for me, it wasn't worth the hassle of sending those PVS impressions out and getting them sent right back because I didn't capture like one little spot. This makes it a lot smoother. My confidence is higher because I know on those really tough cases, like I just had a kid sedation a few weeks ago. Patient with special needs, he's like moderate autism. He will respond to you, but he will not let you like really do too much in the mouth. Barely lets a toothbrush prophy happen in a sense. So he had some work to do. We did it under sedation. I didn't have the appliances ready for him to cement during sedation. So they came, a week or two later after he healed a little bit. Mom did not think we were going to get them done. I was pretty confident because he let me kind of get in there with my fingers. He sat through the cementations of those like better than most 8 or 9-year-olds would. And it just gives you more confidence. Like, Mom, we can get this done. And then those parents really trust you because you can kind of push your limits and understand what you can do for those kids. Marketing on it's big too. It's like, I like when moms are in the office with us, they kind of see the tech, they can ask questions. I can highlight what we're doing. They can go talk to their friends and family members in the neighborhoods and online. Those mommy groups, you want to have some good praise there. And then you can use it yourself as a marketing tool, highlight it on social media, put it on your website, let people know what you are bringing into your office to make you stand different, stand out from somebody else, or just, how high tech your office is and what you guys are using to make dentistry cool in that sense. And then your referring docs are going to be happy. They're going to see not only your good dentistry come back, they're going to see that nice appliance, how nice it looks, and the parents can kind of hype up how it went. And then they're going to continue to refer those patients to you. So you guys keep that really nice back and forth relationship that you have with some GP offices. So I'm going to let Jordan or Aaron jump into some of this. This is going to be more their side of things on the purchasing options. Oh, Jordan, you're muted.
Sorry. But like Casey mentioned earlier, we have essentially 2 ways of buying it. You can purchase the scanner by itself. You're also free to purchase the scanner with the laptop. We highly, highly recommend purchasing with the laptop. Like Casey mentioned earlier, it's going to streamline everything. You'll have remote support. It's going to come pre-downloaded with everything. And you get the same 3-year warranty with the scanner that you do with the laptop. It's going to meet all the specs and everything else. So we highly recommend it, but you are free to purchase if you're familiar with scanning, if you had to scan it before and, you have a really, really good laptop already, and I'll send you the spec sheet. And if you want to go that route, that's perfectly fine as well. But you're also going to receive 4 scanner tips. To begin with, we have the pediatric size, which are actually the smallest on the market, and we're going to have the large size, which is actually just standard for the market. So in that video that you saw me scanning Aaron was actually the regular size tip. So, adults, that'd be my recommendation as well. All the tips are autoclavable. I believe it's up to like 180 times, but what I'll tell you is just put a little like cotton gauze over that mirror when you autoclave them, and it's going to prolong that life quite a bit. And then the training support, everything included with Voxel, they're going to handle all of that. So they'll get you onboarded. They'll work with you on, anything that could be implemented within your office, 3D printers, whatever else. They'll do all of that with the training and everything else. It is really easy just to take out the package and get used to it, honestly. But there's some pretty cool things that they can give you some advice for. Like I know Casey did y'all ever end up doing that, Casey, or y'all just
Played with it.
Yeah. So you're able to do that as well. Aaron, anything else to add from your end?
Just about, I know we keep saying that it's really easy to use, but I am older than Casey. And this morning I was on a Zoom call It wasn't even a Zoom call. See, it was a Google Meet call, and I couldn't even get my headphones to work to connect to my computer. And Jordan had to come over and like figure out which microphone my headphones were connected to so that I could hear the meeting. This is easier than that. So like I was trained for 5 minutes from Voxel on how to do these scans. I did one of my arches, and it took me, I think it was like 3 minutes. They just gave me a couple little tips and pointers, and then the second arch took me a minute. So, I mean, it really is easier than connecting your headphones to Bluetooth.
Yep, no, definitely is. And one of the other things that I didn't get into is not just like your traditional pediatric dentistry. This opens up the opportunity. Like I built a lab in a new expansion space that I just did because I might want to 3D print things on my own in the future. Now I have a scanner that allows me to have a file that will connect to a 3D printer and do that kind of stuff. If you're bold and you want to do actual adult tooth dentistry and scan some, indirect stuff, you can do that too. So, it's not just made for space maintainers and that kind of stuff. You can capture margins. You can do real dentistry with it. And at the end of the day, their support makes it much easier for us in our world. So I'm going to leave this so you guys can grab their info. So obviously Jordan and Aaron joined us on the call today. Chris is also a great person to reach out to if you do have questions about the software itself, the scanner itself, purchasing, kind of how all that works. And then I'll let you guys kind of sit with this for just another minute or so. And then I'm going to put my info up. You can reach out to me with clinical questions, practice questions. I'm an open book. It's going to be my personal email. Shoot me an email. I'm going to get back to you usually within that week, depending on how busy it is. If I'm not super cranking out other aspects of my life, I'll get back to you that day because I like to kind of keep my emails short, or my inbox short in that sense. So that's their info. Great resources. I bug them from time to time about everything from dentistry to not dentistry. And then this is my personal info, and there's Neolab's info as well. So if you need to get a hold of anybody there, if you're inquiring about like, what can I do, or hey, I might have a different scanner already and I want to know if it integrates, they can help you out on the customer service side of things. And then Christian could always be a resource for you guys too. And I think, yeah, that's it, guys.
So y'all, this is your time to ask questions. Like Christian's here. So if y'all have questions of like, hey, I was thinking maybe I could do this or I could do that, like go ahead and put those in the Q&A right now. Cause right now we don't have any. So ask away. Jordan, you got anything else?
No, I mean, Christian, is there anything you want to talk about with Neolab, and anything you want to mention that you might think is like FAQs or something?
Casey hit it all pretty well. Super easy stuff to do, and Casey's using a lot of the SLS 3D metal. You still do a lot of the indirect banding, or if you want to fit your own bands and take a scan, it's still a possibility. If you want to snail mail those bands into us, it'll meet up with the 3D printed model when those bands get finally across the country. But we can do it any way that the practice is in baby step it in too. So obviously Casey's using these SLS. That's pretty advanced. It's pretty awesome. Custom built bands, 3D printed directly for that patient. But you can kind of crawl, walk, run with this too, and get in with the scanner, get used to the scanner, utilize it in what's comfortable in the practice, and then go over to indirect and maybe start doing some SLS stuff. But sky's the limit on whatever you want to do with the digital workflow now, with being able to scan and then being able to CAD design and 3D print any type of appliance that you can think of. It's pretty awesome. It's fun from the lab perspective too.
And again, guys, if y'all have any questions, please ask away. I'd hate for you to, miss the opportunity to have Christian and obviously Casey here. Aaron, is there anything else like you can think about? I mean, talking about you got scanned today. How do you feel? Obviously, I am not a clinician. I am not very good at scanning. So, when you're getting scanned, do you feel anything? What do you notice?
No, that part's super easy too. Like everything is super easy. One thing I think I talked about last time is that like you can set a song to go with your scanner. And so like when I went to Voxel to get trained, they did like the Mario theme song. So like while you're going like through and scanning, it's like do 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 do, and it like goes. And so and if you like miss a spot, it kind of stops. And so like it makes it even more like a video game and super fun. So you can kind of upload or download. See, I don't even know what the right terminology there is, but you can put it on and make like whatever song you want to go to. So you could do it like per season or, you know, your local sports team or whatever. So you can make that super fun. Kids definitely like to see, like watch it be done. It's really, I don't know if you could tell like from the, you know, whatever computer you're watching on, but the images are really clear. Like you can see staining, you can see like caries, you can see, I mean, you can really see like exactly what their teeth look like. I think we had another person say they did like a sports guard like fundraiser where like they sent out like a QR code to the team and said like come into the office, you know, even after hours, scan a whole team, and like, you know, everyone gets a certain price off their sports card, and then you get these parents in your office that maybe weren't, you know, you get advertising for your office too at the same time. So I mean, there's just like, again, sky's the limit. Like it's just kind of the more outside the box thinking that you get, like the more you can really like easy money. Like that's so fast. Like you just scan all these kids and they're in and out, and you just got maybe new customers and a bunch of sports cards made.
Aaron, actually, that point you mentioned, that was actually from the idea for that was actually from Olivia. Christian, I know
Okay.
y'all do
We
quite a
do
bit
a
of,
lot of those. Yeah,
yeah.
it's great marketing. And
Yeah.
with the wireless scanner, as long as you have internet connection to the computer, you're good. Actually, I don't even know if you need the internet connection, as long as it's connected Bluetooth to the computer, and then you can save everything. So you can go to a sports event on the field, scan patients, and have them come back to the practice to pick up their maybe 50% off mouth guard or free mouth guard, just driving patients and parents into your practice just to say hello, because they will remember they got that mouth guard from, you know, the local pediatric practice when it comes to going or changing a pediatric dentist or seeing an orthodontist or something along those lines. So yeah, we do a ton of those.
Yeah.
In fact, I'm scanning my daughter tonight. I have a scanner. She just started field hockey, and so she just started her season, so she needs a new mouth guard. So I'm going to scan her tonight, send it over to the lab, and it'll be done by tomorrow.
Nice.
My daughter's starting rugby in a few weeks. I should probably get her
There you go.
one scanned in.
There you go. Well, just send the scan over to me. We'll
There
get
you
it.
go.
Oh, nice. We had a question pop up. Dr. Cotton, sorry if I missed this. What is the cost difference to make lower lingual holding arch, TPA and ants when sending in a file from scanning versus sending in a stone model?
So high level is there's a printed model. So we charge to print the model. Off the top of my head, I'm not fully confident on prices, but I think the model is somewhere around $13 or so, and then a couple of bands. So instead of you guys fitting the bands, we'll have to fit the bands. So I would say to do a digital LLHA versus something that where you fit the bands and we weld, it's probably going to be a difference of $25 or $30.
Gotcha. And Christian, do y'all, I mean, just curious here, like what is y'all's kind of feedback is as far as like sending in a model to you guys, or, you know, an impression as opposed to scans? Like, can you walk us through kind of that?
Of how we get those?
Yeah, I mean, you know, preference from a lab standpoint. Do y'all have to send back many impressions? I mean, turnaround time, you know, all of that kind of stuff.
Sure. Well, the turnaround time is going to be much quicker with the scans, right? Because we're going to be working on those scans. Those scans are going to be prepped and ready for the printer that evening. So we don't have to wait. That's why I was saying if you still want to fit bands, it's perfectly okay. But that 3D printed model is going to be printed days, if not weeks, before that band gets there. Those bands get to the lab. So it's definitely an expedited workflow when the scans are coming in, and Dr. Casey actually showed our web portal. It's called RX Wizard, and you create a template or multiple templates, super easy to use. You're filling out a prescription within a minute max, I'd say. And we already have the file. So once you tell us that the file is through the AS scanner, we're going to go up, we're going to grab it, we're going to prep the file, we're going to send it back to you. So it's really easy to submit a prescription. Stone models, same thing. If you want to send a stone model and take an impression, it's okay. We still accept stone models. I would say it's down to about maybe 7% of our business at this point is stone models. So huge digital workflow for us. But if you do want to send a stone model, still same. We still ask that you fill out a prescription online, print off the piece of paper and send in that stone model. And the reason for that is we track everything coming into the lab. Once we accept it into the lab, you'll actually be able to follow its process through the lab. And when it ships, you'll get tracking information, or you'll be able to see tracking information. You can turn on and off emails that will come out of our portal system that'll, detail every single case if you would like. If you want to know when every case is tracked and you want a tracking number to show up in your inbox every time we ship something, we can do that. So we keep you in the know as much as you want the entire time.